Hi, everyone. Welcome to the third and final of our series on COVID-19, our San Diego Community Town Halls. Thank you if you have joined us for all three of them. And just as a quick reminder, if you would like to listen in Spanish, please click on the icon below that says Spanish and to remember to mute the original audio. You also, if you want to listen in Tagalog, you want to dial 888-204-5987 and then enter access code 8700-768#. And first, I just want to make sure that we acknowledge all the people that are dealing with severe heat and evacuations due to fires up and down our state. We want to make sure everyone is staying safe and healthy despite the pandemic and despite the fires, despite the heat. So hopefully you're all in a safe place. And let me once again reintroduce our group. So we are the Scripps Hub Academic Research Corps, also known as SHARC. This is a partnership between Scripps Health and Scripps Research that's funded through the NIH's CTSA. And also a thank you to the SHARC Community Advisory Team and the San Diego County COVID-19 Health Equity Task Force, because through their efforts, we were able to design and coordinate these town halls. And specifically, I'd like to thank Marty Acevedo, Dr. Suzanne Afflalo, Carla Corte, Dr. David Higgins, Keisha Robinson, Dr. Rosie Chang-Weir, and from the task force that was started by Dr. Rodney Hood and also has Dr. Suzanne Afflalo as a member, Dr. Jeanette Aldis, Dr. Happy Araneta, and from Scripps Research, we have James Ellis supporting us with the technical aspects of the webinar. We have Spanish translation available through Pals for Health with Ana Maria Garcia, Jane McNeil, and 360 Link Solutions provides Tagalog translations with Emily Edquid and Joshua Ramirez. With that, I'd like to introduce your host for the evening. We have Keisha Robinson. She's the Senior Manager of Clinical Research at Illumina. She's a member of our Scripps Hub Community Advisory Team. She has 20 years of experience in biotech and is also the principal and CEO of Imperative Solutions, which is a local diversity, equity, and inclusion consultancy firm. Keisha?
Hello, good evening, everyone. Thank you for joining us. Tonight, we will be discussing COVID-19, also how high-risk individuals can stay healthy, and how community-based contact tracing works. We'll also hear personal experiences of local COVID-19 survivors before answering questions from the audience. Please submit your questions in the Q&A box. Please allow me to introduce Dr. Suzanne Afflalo, Medical Director at the Alliance Health Clinic. Dr. Afallo is a family physician who retired from Kaiser Permanente after 23 years of service and 16 years as an associate faculty at UCSD Medical School. She received her medical degree from George Washington University School of Medicine and completed her family medicine residency at Kaiser Permanente Medical Center in Los Angeles. She continues to serve the community through several health programs and initiatives, and as a part of advisory groups, including the Scripps Hub Community Advisory Team and San Diego COVID-19 Equity Task Force. Her advocacy established the first 2 testing sites available in southeastern San Diego. Dr. Afallo?
Thank you. Good evening. I'm going to, good evening, everyone. I'm going to share my slides, but I think someone needs to give me permission. Here we go. Thank you so much. And as I pull up the slides, I'm going to speak just briefly about how we can stay healthy during this time. And let me just make sure I get everything up right now. Okay. Alrighty, so let me, sorry, this is all the other way. So I want to speak just briefly about health and wellness. And a couple slides are going to be just going through, I'm going to go through quickly, basically the basics of the COVID-19 pandemic and how it is a novel virus, and that there's 3 strains of the very dangerous COVID-19, coronavirus, and that's the SARS, which is a severe acute respiratory syndrome, the MERS, which was the Middle East respiratory syndrome, and now this one, the SARS-CoV-2, COVID-19. There's been some misconceptions along the way. Briefly, African Americans, didn't think that they could get COVID-19. A lot of people thought that young people and children couldn't get infected by the virus, which we're finding out is not the case. They only thought that seniors and people that had underlying medical conditions were at risk for getting significantly sick or dying from COVID-19. And then people also did not believe that we could spread the virus if we weren't symptomatic. And so obviously what we've been hearing over the last 6 months is how to try to avoid infection, which is wearing your mask, staying separated socially by 6 feet of distance, washing your hands frequently, avoiding touching your eyes, your nose, and your mouth, cleaning and disinfecting common and frequently touched surfaces and bathrooms, and avoiding large gatherings, especially in indoor settings. So with COVID-19, we definitely know that African Americans are disproportionately affected by COVID-19, and they have some of the highest rates of severe illness, death across the nation. African Americans and other minority groups are extremely vulnerable because of their underlying and pre-existing medical conditions. These are what pretty much put them at significant risk. And some of them are diabetes, heart disease, obesity, chronic kidney disease, chronic lung disease, HIV and AIDS, various cancers, and anything that causes immunocompromising condition, a weakened condition. So with that, African Americans and all the other ethnic groups, including the Latinx population, Filipinos, Asians, Native Americans, Pacific Islanders, we are the ones that are overrepresented in these service jobs. We are considered essential and frontline workers, and therefore we're at a much higher risk of contracting this virus because we're out there every day serving the community, keeping our community open and functioning. So of course, if we have increased risk and exposure, most likely we're going to get infected and die. And this is the problem that we're seeing, that the numbers are greater in our populations. So let's talk a little bit about a healthy immune system and what exactly is it? So your immune system actually is something that protects you and defends your body against foreign substances like disease-causing organisms, bacteria and viruses that you've heard about all along as you're growing up, how to try to avoid them. Those things are what end up causing an attack on your body, and your immune system is what tries to protect it. So your immune system normally is very strong and healthy if you take good care of yourself and if you do all the proper things. It is an entire system, so it's not just one entity, and it's not a set of pills that you can take over the counter that all of a sudden boosts your immune response. It is just think of it as a package deal. So antioxidants are things that are found in very colorful fruits and veggies, and those are the things that help to boost your overall health and immunity. They protect against damaging the cells of your body. So if you're taking a lot of antioxidants, those tend to protect your cells, which is where the virus and bacteria tends to try to attack you. Also, taking daily multiple vitamins helps to build up that immunity, and it gives you the requirements you need daily. Specific ones are vitamin A, C, D, and E. Those are pretty critical for your healthy immune system. Some other essential minerals are zinc, selenium, magnesium. Those are very essential for not only building your immune system and keeping it functioning, but your overall body to keep it healthy. So what can we do to really keep ourselves, some self-care and have a healthy immune system? The first and foremost thing is really just trying to do all the right things to take care of your body. So every single part of your body, including your immune system, functions better when it's protected from environmental assaults, and improves the overall thing by living a very healthy life, using healthy strategies. So eating well, which you hear everyone talk about it, but it's crucial to make sure that your immune system is healthy by eating healthy, putting very healthy things inside your body, making good choices, eating plenty of fruits and veggies, getting adequate sleep. So sleeping 6 to 8 hours, if you can get that in, really recharges your battery and helps with your immune system for your body. Drinking plenty of water and avoiding all the other types of fluids, especially sugary beverages. Exercising regularly is so important just to keep everything in check, and minimizing that, if you can only do so much, try to get 30 minutes in at least 5 days a week, a total of 150 minutes per week. Maintain a healthy weight, so trying to avoid obesity. If you're carrying extra weight, try your best to get some of that down so that you have a chance of avoiding the increased risk from just having obesity. Minimize your alcohol intake, do not smoke, and then definitely avoid any kind of illicit drugs. Try to minimize your stress, avoiding stressful situations, doing relaxation techniques, medication, breathing strategies, yoga, reading or listening to any kind of motivational materials. Those things are very helpful to try to minimize your stress level. And then, obviously taking the necessary steps to avoid infection by just washing your hands frequently and avoiding people who are sick. So in the mental health piece of it, this pandemic has really caused a lot of significant problems to everyone. No one has been, eliminated from feeling any kind of duress from it, whether it be health-wise or mental health, or knowing someone that's being exposed. So the pandemic has been very stressful to everyone, both adults and children. It's caused a lot of fear and anxiety, knowing that this virus is out there and it's very deadly, and especially for people of color. So once we were told to stay at home and to social distance, it really made a lot of people feel isolated and lonely. And although these actions are necessary to try to decrease the spread of the COVID-19, it caused a lot more fear and anxiety and depression. So the fear and worry about your health and the health of your loved ones has been a real key factor. The stress from all the financial situations that are going on, people that have lost their jobs, people that have lost their health insurance, that's caused a lot of stress. Changes in the sleep and eating patterns just from being stressed. So now you're either overeating or not eating the right foods. You're not sleeping well because you're anxious and stressed. You're having trouble concentrating. You may even be having some worsening of your chronic health conditions, which is going to put more anxiety on you. And then just the mental health thing. So if you have any underlying mental health conditions, anxiety, stress, bipolar, those things can get exacerbated during this time. So also we're noticing that as people have to stay at home and hunker down, if there's any kind of stress that's been going on at home, people tend to act out differently. So we're noticing that there's increases in domestic violence, abuse, trauma, and suicide. And then obviously for people that rely on other things to help manage their stress, there's increase in tobacco, tobacco type substances, vaping, and things like that. So obviously everyone handles their stress differently. Some people overeat, some people oversleep or don't. Some people do things that can cause more harm. So how you handle your stress really depends on various situations, your background and how you handle things in the past, your social support, your family and friends. If you don't have a nice supportive network, you can certainly be at much higher risk for having more underlying activity with mental health. Your financial situation, obviously physical and emotional health, and just the community you live in. If you have a supportive community and you can, say hello to your neighbors next door from a distance, that helps. And how you respond to it really is the skill sets that you use throughout your whole life. So with that, I'll just say that, where there's a lot of things that can take place, but the way how you do it, the most important thing is trying to just maintain your stress level in terms of minimizing it. If you have a counselor, reach out to them. Take lots of breaks away from the things that are going to cause harm, like social media, watching TV, reading, things that are harmful, to your mental health. And then making sure that you have, some access to 911 and helplines, suicide, domestic violence, and things like that, if you find yourself in situations that are not helpful to you. So in that regard, I'm going to wrap it up because we have lots of other speakers. And most importantly, just do your best to stay healthy. And if you're having mental health issues, please reach out to someone. Thank you.
Thank you, Dr. Afallo. Next up, we have Whitney, a local San Diego resident and COVID-19 survivor. Whitney.
Hi. So my experience with COVID, I was exposed in March 6th, I got exposed. And then I developed symptoms about 4 days later, which started off as just a kind of a tickle in my throat. Then it progressed to a cough. And then from there, got some congestion with that. And I mean, it just really knocked me right on my bottom and really made me fatigue. And it took a long time for me to recover. It took about a good 3.5, 4 weeks to feel like I was getting back to normal and that I was starting to beat the virus. Thankfully, I don't have any comorbidities at all. So I felt fortunate enough to not experience worse symptoms than I did. And then, so yeah, I was quarantined that whole entire time. I was with my parents, and unfortunately that got passed on to my dad, who then himself, he got COVID and spent 73 days in the hospital. And thankfully since then, he went to rehab and has now been home for about a month. But almost took his life, and had to learn how to speak again and eat again on his own. And he's just now starting to walk again. So it's definitely not just affected me, but my entire family. And so it's been really tough to see others not understand how hard it can affect those that you love and your friends and your family. So thankfully we have made it on the positive side of all of this, but it's definitely changed our lives over the past, gosh, now 5 months, which is crazy. It does not feel like 5 months ago, but yeah, my experience, it was hard because I was more towards the beginning of this whole virus. So, you know, I felt like I was one of the first people to, for myself, who I didn't really know a lot of other people who had gone through it. So I wasn't really knowing what to expect. And then my dad just had a totally different experience than I did. But yeah, I hope that no one else listening experiences this. It's pretty traumatizing, and even after the fact, it's still, I can still say I'm not fully up to the ability of, you know, being able to go on a run without experiencing shortness of breath after I'm running. But I'll hopefully eventually get back to it. But that's been my experience with it, but thankfully I'm on the upside.
Thank you very much, Whitney, for sharing your story. We truly appreciate that and wish you and your father continued health improvement. Next to share her story is Lakshmi Korapella, a former Scripps Health resident physician who was hospitalized with COVID-19 at the same hospital where she was completing her training. Lakshmi?
Hi, everyone. So, you know, I thought I was a relatively low risk person to get COVID despite working in healthcare. I had heard about Whitney's story. We have a lot of mutual friends, and that same patient encounter that she was exposed to, a lot of my friends have been exposed to. So it was early March, and all of a sudden I had 6 friends quarantining. And so the pandemic was very real to me early on. I had been social distancing. You know, we were really fortunate in San Diego to have adequate PPE after learning about everything in New York. So I felt well prepared at work as well. I'd also been participating in the TSRI study and getting tested for asymptomatic healthcare workers, and had been tested negative several times in June. But then actually one day after my last test for an asymptomatic healthcare worker, I started to develop some body aches. I had thought that I had overdone it with exercise. It was just a very non-specific symptom, so I wasn't too worried. And that night I had a low-grade fever, and just being young and otherwise healthy, you know, fever in the middle of summer, of course I was worried about COVID. And I got tested through Employee Health. It was a bad test. I knew it was going to be negative, and it was. So I was just trying to reassure myself at home. And I think that's one of the things that's most striking about this pandemic is how alone you feel. Especially, I really sympathize for Whitney because she was so sick early on. By the time I was sick, I had so many people I could reach out to say, did you experience this? Did you experience that? So I had been checking my pulse ox at home, and I actually had, you know, a couple different urgent care and emergency department visits with symptoms of shortness of breath and low oxygen saturations on my pulse ox, and I got discharged home. But eventually they got so low that I went in and was hospitalized at Scripps Green, which is where I had done my residency. So I was actually feeling really fortunate because I think the pandemic is so lonely, no visitors are allowed. And if you're in the hospital, the most you can hope for is to recognize your staff. And that was really helpful. It was really scary for me. My specialty is palliative care. So I'm seeing out of proportion the worst outcomes of COVID. And, you know, being in the hospital, having to briefly go to the ICU, I was really in a bad place mentally. Like we were talking about, Dr. Afallo mentioned, it was hard to cope with because you're just thinking about all the bad outcomes and how alone you are during that time. But I was fortunate, like Whitney, to recover, and I'm feeling pretty close to normal now. I saw a couple of questions in the chat box. about if there's a bad test. So I had gotten so many COVID tests as part of the healthcare study that I knew that they didn't go, it wasn't a good nair swab. It really felt superficial. So it's like, unless you have such a big viral load, I anticipated it would be negative. And then I think someone else had asked if we felt any stigma being a COVID survivor. And I would say, I haven't felt much stigma being a survivor, but I think being a COVID patient, you definitely feel a little bit of stigma, especially in the hospital. You know, you're going to get less visitors as far as staff. You know, people are trying to cluster their care, which is all very fair. And being on the healthcare side of things, I definitely understand. But I think as you're getting cared for maybe a little bit less, even though there's so much is going on behind the scenes, but I think you feel like there's some stigma against you.
Thank you very much, Lakshmi, for sharing your story and your interesting perspective from both sides of the bedside. We truly appreciate it and wish you continued health as well as you continue to work on the front lines. Next, I would like to introduce Dr. Hala Madanat, the Director of the School of Public Health and Interim Vice President for Research at San Diego State University. She's also the core investigator of the Institute for Behavioral and Community Health. Dr. Madanat received her Master's of Science in Community Health and her PhD in Sociology from Brigham Young University. Her research focuses on the impact of Westernization on diet and nutrition, and she also leads the evaluation of 3 large NIH-funded center grants. Together with Dr. Corrine McDaniels-Davidson, they are leading the Communities Fighting COVID, which trains community-based contact tracers. Dr. Madanat.
Thank you so much for this opportunity to chat with all of you. So my focus today is going to be on the contact tracing and why it's important and what it is. So once a person has tested positive, the first stage is what we call a case investigation. This is a call where an individual is, where the case is called usually by the County of San Diego in San Diego to identify where they may have been, who they may have been in contact with, and who and when we talk about who they've been in contact with, we're talking about obviously household contacts, but also individuals in their work environments, or if they haven't been on the more careful side of things and sheltering in place during shelter in place, where they may have been in contact with individuals for more than 15 minutes and within that 6 feet distance. And so those are once we have the list of what now we call close contacts, then contact tracing starts. So contact tracing is going to these individuals that were identified as close contacts of a known positive case. These individuals are then contacted, and they are requested to self-quarantine for 14 days. And they're provided with instruction clearly on what that means and how to protect the rest of their families and their household. In our case, in the San Diego State University contact tracing contract that we have with the county, we have gone beyond the regular contact tracing, which is typically done by the county, where they attempt to call individuals 3 times within 40 hours to try to reach them. If they don't reach them, they send them a letter, tell them they've been potentially exposed, and then ask individuals to call the county back. So we have multiple ways by which we're working with the county on this contract, which include one, in the case of an individual that they cannot reach after 3 attempts and they've sent a letter to, then we are deployed for a home visit potentially. So we go to the home, we try to identify these individuals, we try to reach them, and we try to explain to them the importance of self-quarantining. And within that, we also, we are doing the work, which is a step further as well with the contract, is to do referrals. So individuals, as we're doing this work in the community, we're realizing how much needs there are in terms of food, in terms of linkage to unemployment, in terms of linking even to opportunities for quarantining outside of the house through the county's motel program that they have. So there's a lot of referral that are done by community health workers. So we've hired contact tracers that are community health workers from communities that are underserved in San Diego, where we're seeing disproportionate cases. So specifically, we're focusing on the African-American community, the Spanish-speaking community, the Arabic-speaking community, and the Tagalog-speaking community. And so we've recruited community health workers across all of these groups, and we are getting the data from the county to identify close contacts and then reaching individuals. Initially, the attempt is through phone, and if we can't reach them as well, we do home visits. So the idea is to really try to reach people. I want to emphasize the importance that contact tracing, if done well, and if people are engaging in it in the community, is really the way by which we can stop the spread. So that means, you know, if we know you've been potentially exposed and we quarantine you for 14 days and minimize your exposure to the rest of your family or coworkers or others, then the risk of, if you develop symptoms within those 14 days, your ability to then be immediately isolated and not have seen people during the period of pre-symptomatic, the pre-symptomatic period before you have any symptoms that could be infectious, we've protected others. And so that immediately goes from a case to a close contact to a stoppage. And that's what we're trying to achieve. And if we're able to reach close contacts at a fast pace, and we get them to quarantine for the 14 days, we should be able to do a really good job mitigating the spread of COVID-19. So I'm happy to take additional questions about our program or about what contact tracing is intended to do and its importance. Thank you so much.
Thank you, Dr. Madanat. Next, we will be transitioning to the discussion portion of the evening, moderated by Dr. Jonathan Wosen. Dr. Wosen is currently the San Diego Union Tribune's biotech reporter. He received his PhD in immunology from Stanford and received training in science communication from UC Santa Cruz. Dr. Wosen.
Thank you, Keisha. And thanks everybody for being here. So we'll jump in a moment to probably the most important, most interesting part of this, which is really the Q&A, where you can ask your questions and I'll help direct those to the panelists. But first, just to take a moment to, I'm going to launch a couple of quick polls to kind of get a sense of where people that are on this call live, and then a couple other basic questions. So you'll see those polls pop up on your screen. I'll give everybody about 45 seconds to a minute to answer each of them. So you'll see that launching right now. The first question just being where you live within the county. Hope you like Jeopardy! everyone. Okay, thanks everybody for bearing with us, getting some good answers there, and sounds like the music was sort of a good thing. So we can go ahead and jump into the Q&A. One question, and I'll direct this to Whitney and Lakshmi, that came up in the Q&A was essentially, how were each of you treated? You know, once you tested positive for COVID, what was the actual course of treatment that you went through before your recovery? And maybe Whitney, we'll start with you and then jump to Lakshmi.
Sure. Yeah, mine's definitely different from Lakshmi's because I was as an outpatient. So for me, I had to take like a cough suppressant. So I had like Tessalon pearls I was taking, and then it just wasn't getting better. So I ended up needing an albuterol inhaler. And then just some Tylenol as well. But it was definitely taking those for about 2 weeks during my course.
And Lakshmi, can you speak to sort of your treatment experience? I think you're on mute. Okay, there we go.
I was sick at the end of June, so my treatment was a little bit different. And I was sick enough to be in the hospital on supplemental oxygen. So I got kind of everything. I got plasma, a dose of remdesivir. That was the same week that all the preliminary data had come out about dexamethasone. And so I had also gotten steroids. I got everything.
Okay. And ultimately some combination of those treatments was helpful.
Yeah, it's hard to know what made the difference, I guess. But.
Yeah. And then maybe just to ask each of you a kind of follow-up question. This is something that came up, I think, earlier in the pandemic, although I think we've since kind of come to question it. But there were a lot of comparisons between, the flu, right, influenza, and this novel coronavirus. If each of you could sort of speak to, times you've had the flu or maybe the cold in the past, and really how different has this experience been for you? I mean, maybe Lakshmi, it's kind of very clear in your case, but Whitney, we can start off, and if you want to address that, that'd be great.
It was different for me. I've had the flu. Fortunately, it was only like once before. I had body aches for about just probably 1 day compared to the flu, where I felt like it was ongoing for like 3 days of body aches. And with coronavirus, it was a persistent dry cough that I was experiencing, which I never had with the flu. So it was a lot more respiratory issues with coronavirus than with the flu. I felt like the flu was more like a nausea, vomiting, body aches that I've experienced in the past.
And I know you mentioned still feeling a little bit of shortness of breath when you're on a run. I mean, have you ever...
That could be that I'm just out of shape, but
sure.
We'll blame it on coronavirus. But I can tell when I do go for hikes, though, it's definitely more laboring to try and do what I once did before. So it's just taken a lot to get back, like reconditioning myself to get back.
Yeah. And Lakshmi, I don't know if you have anything you want to add to that.
Yeah. So mine, I think for the flu, I agree. I'm used to having like more body aches, but for coronavirus, I was most shocked by the fevers. I don't know any time in my adult life that I've had, consistent fevers, 103, 104 Fahrenheit, that were not breaking with Tylenol. So that was really the biggest symptom.
And then maybe a question for Dr. Affallo in terms of, wellness and managing everything that I think we're all going through in different ways during this past year. You spoke a little bit about ways to deal with stress, but maybe we can take a little more time to give people some practical tips when you're, maybe for folks that have kids or, difficult situation at home, and, you're kind of not seeing a light at the end of the tunnel in terms of this pandemic, or not really clear, when things are really going to improve measurably. When you're feeling sort of pessimistic and frankly a little hopeless in that whole cycle, what's some advice that we can all, a couple strategies we can all be using going forward?
Well, I think it is most important that we definitely try to stay healthy, and the fact that we now are more at home, we should be focusing on probably preparing more foods at home rather than the constant busy schedule we had where we're driving through and picking up fast foods. Now's the time to focus on eating healthier, taking in more fluids that are healthier, and actually still being able to get out and do some walks. It's been hot this past week, but when the weather settles down, you can go out and do your walking. In the evenings when it's cooler, you can still do some social distancing with friends. You don't have to continue to stay isolated. You can, as I've recommended to people, go out to a park and you use your blanket with your picnic lunch, and you guys can sit 6 feet apart and still be able to socialize with friends, get together 2 or 3 friends at the park and sit there and just talk and connect, because this whole mental health thing is just so real that if the more we stay isolated, the worse it's going to get. So there's no reason to stay locked in the house. You can still go out, wear your mask, sit 6 feet apart, and then sit at the park, and talk to each other and reminisce or talk about how you're getting through things. So I want to make sure that people know that they don't have to stay locked up in the house. There's reasons why we want you outdoors. It's less of an issue when you're outside, but you still need to do the mask and the social distancing, but you can get together, you can actually go to lunch and separate out and do things like that. So it's very important that we try to find some normalcy within the middle of this pandemic right now.
Yeah. And in terms of what you were saying earlier about, exercise and staying active, you can go for a walk, you can take a jog, you can't necessarily play a big game of basketball, for example, but you can be active in other ways, right?
Absolutely.
Dr. Madanat, a couple questions about contact tracing. One question was, and this will maybe lead to a broader question, but so do contact tracers collect citizenship information or, social security numbers? And maybe, question to go alongside with that, what are people sort of hesitant, in your experience with contact tracing, as far as what they're sharing, as far as, where they've been and who they've been in touch with, and how much of that information gets collected, and what are the potential risks there?
Fantastic questions. So no, absolutely no data is collected relating to citizenship, to social security, to any data at all. But what I would say is we've had better success in our underserved communities than others have in having people answer honestly and provide us with information, because it's a community health worker model, because it's people from their own communities coming to them. They've built trust. They spend a lot of time building trust and rapport before they get all the information. So it's a significant more time, I would say, than a usual contact tracing. And it really is looking at all the needs that individuals have. So I'll give you a clear example. Is in the first week, several of our community health workers identified that in multiple homes they've gone to, there was not a bite of food. There was no bread, there was nothing in the homes. So they came back to us and said, can we do a food drive? Can we have our cars loaded with food so when we do these visits? And I think those types of things is what really makes the difference in people's willingness to provide the information and tell us where they've been. And so I do think it's that part of it that really, it's not somebody distant from an office that's not from the community, that doesn't really connect with them.
And you mentioned earlier that really contact tracing is one of the best tools that we have for controlling outbreaks. What do we know from past, infectious disease outbreaks in terms of how effective contact tracing, really is? It seems like maybe it's an effort that wouldn't necessarily always completely catch, right, every possible contact, but if you can just speak to how well it works based on past evidence. So yeah.
That's a phenomenal question. One of the things is it depends on how fast we are in our testing, right? And so the testing piece is one that the county in their laboratory part have done really well, and their new contract with Helix has been well, but our commercial labs have been really slow. And so if they take 9 days to give you results, even if I called you after 9 days because you've been positive, right? How many people have you been around during that time? And our ability to really control that, and the amount of those in 9 days, those people potentially are already positive and they may have infected additional people. Contact tracing becomes a little less useful the longer the testing period is. I can tell you that historically though, with things like Ebola, contact tracing was extremely useful in Liberia, for example, and other countries. We know that in New Zealand right now with COVID has done a really good job. So has several countries in the Middle East done a really good job, like Jordan and Israel. If we follow the track record that's similar, where you quarantine immediately, you test really fast, you isolate and you quarantine close contacts, it's an extremely effective approach. We need to know more about we need to do a better job at testing speed, I would say.
And I guess where do you see the county being at right now in terms of how quickly it's able to trace down those close contacts?
Really well. So I think right now their last number, and I haven't pulled it up today, so I apologize, but it was in the 90s within the 40-hour period. So really high number. And now, what I would say is it depends on how many people got the testing through the county or the Helix contract, because again, there's a big subset of, or the hospitals, because the hospitals, several of the community clinics, like I saw Dr. Ramers on the call, like Family Health Centers is doing a fantastic job on really speedy turnaround times. It depends on when the testing is and the speed by which we're getting results. But in terms of once the county identifies a case, I think they've done a really good job at contact tracing.
Thank you for that answer. Another question for both for Whitney and Lakshmi. So the question is essentially, do you feel differently having gone through COVID-19 about wearing a mask or vaccine trials, given that kind of firsthand experience? So, maybe beyond the experience of having the disease, has going through it kind of shaped the way that you think about some of the preventative or protective measures that we've been talking about? Whitney, I don't know if you feel comfortable taking that one first, and then we can take it to Lakshmi.
So with mask, definitely I feel like anytime I step out of the house, I'm wearing a mask. And just unfortunately, at the time that I got COVID, it wasn't at a time when my work was providing masks. So I unfortunately was kind of in that early stage where it wasn't really provided at that time. So in regards to the vaccine, I would love to be one of the guinea pigs for it, and absolutely I just hope it happens sooner than later. But sorry, what was your other question?
Yeah, no, that was essentially the question. I'd be curious to know if friends, family, sort of coworkers, people in your circle have, when you share your experience, has it kind of influenced the way that they think about wearing masks or actually following social distancing and some of those other steps?
I think definitely more once when my dad got hospitalized. Yeah. I think a lot of our family, friends, a lot of people don't think, hey, this is not going to affect me. I'm not going to be one of those people because I wear a mask or something, but it's so much to it that I feel like once it starts to hit home more, people are like, okay, I actually know someone personally, then they're taking a little bit more precautions. It's just sad that it can take to that point of when you know someone personally who has it, and then you're thinking, okay, I need to take this seriously. So I do feel like once my dad got it, that a lot more of our family and friends took it to the point of, you know, quarantining themselves at home and just being really good about wearing their mask and social distancing. So
Yeah. And Lakshmi, I know you're sort of in healthcare, so maybe your level of attention and how closely you're following all those health protocols is already pretty high. But has actually having COVID changed in any way the way that you've been social distancing or wearing a mask and all that stuff?
I think I've been doing kind of the same, but it's changed how I view advocacy for these things. I think before I got sick, it was a lot of, encourage people and then just do what I can to protect myself. But after I got sick, I realized how important it is to kind of make other people aware of this. I know I got a lot of messages because, I'm in my 30s and I really am not otherwise a sick person. And a lot of people told me I'm the only person they've ever heard of getting sick. And so people have messaged me that they're like trying a little bit harder to wear masks. They've been, educating their parents about things. So hearing that makes me feel like it's important to keep reminding people that they can get sick.
Yeah, thank you. Dr. Afflalo, there's a question here about whether there are any health implications with wearing a mask while you're engaging in physical activity. So essentially exercise, right? If you're exercising with a mask on, is that bad? Is that potentially harm you in some way?
Well, personally, I think it depends on what you're doing and the sport or the activity. If you're actually just jogging along the street and there's no one around you, there's absolutely no reason to have to wear a mask. But if you're walking the street and there's several other people in your community walking, you should put that mask on when you're getting close to them, to respect them and to respect yourself in terms of the exposure. I mean, I play tennis, so obviously I'm not going to wear a mask when the opponent is way, 40 feet away or something, and we don't get that close together. So the point is, it depends on what you're doing and if you need to do. I've seen bikers having mask on, and I've seen other people that don't. So I think if you're just going to be anywhere within that 6 feet of distance from anyone, you should have a mask on. And outside of that, if you're there by yourself or you're kicking the football, the soccer ball around by yourself, no problem. Or if you're at distances where you can just kick the ball back and forth, there's no reason to wear a mask. But if you're going to be within 6 feet of distance from anyone else, you should wear a mask no matter what you're doing.
Got it. Dr. Madanat, a couple questions regarding community health workers making home visits. So for one thing, how are they received? So are people sort of a little freaked out that these folks are coming into their home? Are they getting training in how to safely conduct those visits? And is the work risky for them?
Wonderful. Okay, so first question, in terms of, we do text the family or the close contact prior to the visit to let them know we are coming. So there's a heads up. We don't show up. There is a hesitancy sometimes, especially right now, and because there's census visits happening at the same time. I think there is, but we haven't dealt with it at an extensive level where I'm concerned that we're not being received in the homes. But we do know that people want to know for sure. And so we have badges that display our community health workers, their name, the logo from Communities Fighting COVID, the county logo, and San Diego State. So it does represent that we are a group that is here to do this work. So for the most part, I'd say received very well. In terms of the second part of the question is, are they being trained? Absolutely. They go through intensive training. They are provided with full PPE, protective equipment, obviously. So they have the masks, the shields, anything they need to ensure their safety. The risk is minimal, given that we do provide them with all the needs they have. We do, if possible, recommend that the interviews happen outside the house, if there's a front porch and it's there's the ability. We try to train them to really provide opportunities, but there is a need for them often to be in the home to help people identify places in the home to better quarantine or how to quarantine, especially in households that may be multi-generational or may have the single bathroom. We really go in, our community health workers are trained to look at the layout and figure out what's the best way for this individual to quarantine and protect their family. Because in a lot of our communities, people don't want to go quarantine away from their household, and rightfully so. It's not the easiest to leave your family for 2 weeks.
And then another question kind of on the note of quarantine, I'll direct it to you, although Dr. Afallo, if you want to chime in, that's perfectly fine. How are asymptomatic persons, so people who test positive for this virus but feel otherwise fine, how are they going on quarantine and recovering without any treatment? Why does staying home somehow do the trick for that 2-week period?
So I guess, let me rephrase, is the questions that if they're asymptomatic, do we need to isolate them? They test positive, but they're asymptomatic. Do we need to isolate them from the rest of people for the 2-week period still? If that's the question, then absolutely yes. And what does it do the trick? It goes back to what Dr. Afflalo says, is how your immune system is handling it, right? So it's different for different individuals. I let Dr. Afflalo, I'm not a physician, so I'll let her do the medical aspect of it. But from a contact tracing perspective, the idea is, again, isolating any individual who's positive prior to whether they're symptomatic or not. We know they're carrying the virus. We want them away from others.
And I'll just chime in and say that the reason why people may be asymptomatic initially, and they may not ever get symptoms, but the ones that get exposed and maybe take a handful of days to have the viral load increase into their body, that they're actually starting to get symptoms, whether it be fatigue or respiratory symptoms, is one thing. But yes, if we get an asymptomatic carrier, which seems to be the bigger picture right now, that's how the spread is going on right now. People are walking around with the virus and don't know it because they're not symptomatic, and they're around their friends and family, maybe not necessarily doing all the things that we're recommending with the social distancing and the mask. And therefore they don't realize that they're spreading it, but they are. Next thing you know, one of their contacts actually gets sick. They may not get sick, or they may get sick later. So it depends on the level of your viral load and when the symptoms come about. And the reason why we quarantine them, isolate them for the 14 days is because even if you're asymptomatic, you still are carrying a viral load that can spread to someone else. And we need to allow it to then pretty much dissipate, the viral load to dissipate, where you're no longer infectious. And that's what they're saying. That's why we try to keep even symptomatic or asymptomatic people separated from everyone else for at least the 14 days. So the viral load has a chance to go away, and then you can safely go back out, with the same precautions though. Mask wearing, social distancing. The virus needs something to hang on to. And if we can just stay away from each other for a period of time, we can actually get rid of this. We're just not cooperating with the recommendations, and we're not masking, and we're not social distancing. We're not avoiding the family gathering for a birthday or a graduation or whatever. And we're learning the hard way that if you don't listen to the scientists and the doctors, we're going to continue to suffer. 172,000 people later, souls are lost because we're just not paying attention. We're not doing it uniformly across the nation. And so it's whack-a-mole. We get it down over here and then it pops up somewhere else. We whack it over there. And so until we do this uniformly as a nation, we're going to be struggling. Unlike places like Taiwan and New Zealand and all the other places that have it zero or very minimal infectious rates, we're hard-headed, and we're learning the hard way by the souls that we've lost.
Whitney, there were actually several questions in the chat about your father, who obviously really, really struggled with COVID. You mentioned, is just beginning to speak and walk again. So if you feel comfortable answering or not comfortable answering any of these questions, that's perfectly fine. But folks were basically wondering if he had any underlying conditions, or if he was in a, based on his age, may have been in a risk group for COVID, or even if, your sense of whether he could have gotten it from, when you might have been infected, or if it didn't necessarily line up in terms of timing.
Yeah, when I got COVID, and then I was issued like a quarantine from the county. And so that also, they told my parents they both needed to stay put because I had already been in their house. So we kind of, the three of us stayed put in the house. He is 68 now. He turned 68 while he was hospitalized, so he missed his own birthday. But his comorbidities, it was obesity and hypertension were his pre-existing conditions. And he started off with the same thing with a cough, and then it was for about 4 days, and then he was on the couch and he just looked just pale and had like 102 fever, and then went to urgent care, and took a good 4 months to get him back home. But yeah, so definitely comorbidities with him.
Yeah, and obesity and hypertension, both pretty common comorbidities as well, right? Question that came up in the Q&A, and I'll kind of field this to Dr. Affallo, but Dr. Madanat, if you want to chime in, that's good too. Can you speak to, because we were talking earlier in your presentation about how this virus has hit communities of color hardest from the data that we've seen. Can you talk to sort of why it's been relatively difficult to recruit people of color, and in particular, say Black people, for vaccine testing? But in terms of trust, in terms of people's assessment of risk versus benefit, what are some of the big obstacles there?
Yeah, well, you actually listed quite a few of them. I think the number one thing is trust. Our communities of color just don't trust the health professionals. They have abused them and used them for decades and generations, that we just don't trust the health professionals in general. And so what they need to do, and we have been approached by them, and thank goodness Scripps, SHARC thing, they did our last webinar, our town hall was last week about the viral trial, the vaccine trial. But the way how we're gonna have to embrace our community, because I think it is important at the end of the day that we get involved with it, because the only way we're gonna know the vaccine's gonna work on us is to try it on us. But we have to lay the foundation of building relationship and trust, which takes time. So when someone approaches me to say, hey, we gotta get 500 people or 1,000 people enrolled in 6 weeks, that's impossible for the population we're serving. We need to, even if you use trusted messengers like myself, Dr. Madanat, and various other people, we still need to convince the people that it's okay this time. Because the last several times of coming into the community and asking to do something, you go away, you get your data, and you do nothing to improve the health of the community. So what I'm saying is that until you can promise us that once the vaccine, we participate in the vaccine trial and is safe enough to do it, that we were gonna be the first ones in line to get the vaccine after it's been tested and proven to be safe. We don't want to be the last ones after you use us as guinea pigs to prove that it's safe and then put us on the back of the line. So until you can prove to us that it's okay to use us and then come back with something to improve the health of our community and prevent us more of our people from dying from this, then I say that the only important thing to do is give us the time to embrace you guys as an organization that's coming in to ask us to participate in something, and then promise us something at the end that you're gonna do something with the information and benefit our community. And that's really what we need to do.
And Dr. Affallo, that was fantastic, and that's absolutely right on with everything we've seen in the community. I would add is, we're doing, the vaccine trials are trials, and we don't know the risk fully, right? And so that's part of the problem, is people have been exposed for years to trials, and it's the potential by the time it comes to public should be low, right? But it's not impossible. And that risk makes it hard for many of us to just go out and say, well, you should, because we really do need the data, and we do need to know it works on community of colors. Absolutely. There's no way we can just test it and not involve communities of colors. But we can't guarantee ever, right, that there is zero risk to this. And I think that's the hard message for those of us who've been doing community work for years, is to be the messenger and saying, we need you. and we need you because in the future it has benefit. It is a really hard sell sometimes. So yeah, and so I do agree though that we have to build that trust over a long time, and we haven't done it in many communities of color in San Diego even, and so it's really hard to ask right now.
Yeah, no, thank you both so much. Thanks to all of our panelists, and thank you to every single person who posed a question. If we didn't get to your question, we're collecting those questions and we'll try to get them answered after the town hall. So I'm gonna direct it back to Keisha as we wrap up.
Thank you everyone for attending tonight's town hall. We definitely would like to thank our panelists, Dr. Afallo and Dr. Madanat, for your insight. A special thank you to Whitney and Lakshmi for sharing your personal stories and your transparency. We truly appreciate it. And it just totally humanizes the situation and puts a face to something that people believe, oh, I can't get it. And you've shown that you can, even if you're, taking the best of precautions and working in the most protected space. Everyone, please know that, also special thank you to Dr. Wosen for moderating these town halls. For this third and final one, we truly appreciate you as well. Please know that we will be sharing recordings of all 3 town halls on the YouTube channel for the Scripps Hub Academic Research Corps. Please remember to follow updates from your local scientific, clinical, and county experts for the latest updates on COVID-19 and related research. If you can see, there are links available showing right now on the screen for you. Try to screenshot them very quickly if you'd like to do that. Also, you can follow the Scripps Hub Academic Research Corps on Twitter right now at Scripps SHARCs. That's SCRIPPS You will now be redirected to a brief survey to help us understand community needs for COVID-19 and other events that you could be interested in. Thank you again. Stay safe and stay healthy, San Diego. Take care, everyone.